How have you been, Deepak? I see some interesting updates coming from Eka. A lot of news updates, a lot of, I think, action happening in health space.
Yeah, it's been exciting. We've been here for now almost a year and a half, and things been exciting. We're learning, producing every day something new. So things been exciting, keeping us on our toes.
Wow, awesome. Great. So let's get started, Deepak. While people will continue to come in and we'll continue to possibly talk, but to make sure that we make the best of this time. So first of all, thank you so much for accepting that invite, for coming over and join me on this coffee chat. It's been really wonderful having you here. I was actually talking to Mohit for quite some time to see if I can possibly sneak in to your schedule and get some time. And I think it was great to have that conversation maybe a couple of weeks back to get this through. Coffee Chat is a very interesting platform that we started last year, and the whole idea was to kind of bring in people from the key industries and talk about some of the problems that they're solving, and what are the key things that are very, very important so that people can possibly learn. So I've had Sushim from SAP talking about bridging the supply chain gap through the platform. I've had Alex from Google who came in and spoke about impact sourcing, one of the less spoken terms in India, but globally kind of catching up really, really fast. And then obviously from Wakefit, from Walmart. After having all those conversations, the one area which I felt which I could not really touch was health, right? And I think you have made a kind of 180-degree shift from the travel sector that you were into and now into health. So let's get started with a quick introduction about yourself. I'm sure that if you know of Red Bus, if you know of Goibibo, and if you know of GoMMT, if there is one guy which has been kind of standing behind the entire operational game behind all these platforms, building from scratch, it's Deepak. So please, Deepak.
Uh, Thank you, Kapil. That was really nice of you to say those words. As I just noticed one thing, right? As like whole digital industry, health is being the last, and in your list of people you've been talking to is also, I probably feel would be the one of the last ones to get that position. And unfortunately, that's how the whole industry is, and that's why one of our reason for being here. So as you said, building travel for years. So I and Vikal were co-founders of Goibibo. We acquired Red Bus, and then got merged with MakeMyTrip, and then after doing commerce and travel, we were thinking of doing something, and then the whole concept of looking at what's an opportunity of healthcare and how can healthcare be digitized is what when we started doing some discovery, and thanks to Arogya Setu and the whole lot of people in my team, including Vikal, was the chief architect for Arogya Setu, and that's when the interest for healthcare started coming up, and then we figured out the many opportunities. The doctors are now writing with the pen, digital prescription. There are no health records in India. It's a unique position. We don't have health records at all. There is no place to look for them. Every time you need to get them done, you'll have to kind of redo again and again. I got kids, their vaccination cards are missing, etc., etc. When you shift one house to another. So those were the opportunities, kind of clearly visiting up, and government was also, kind of started pushing a lot towards this whole digitization of healthcare, starting with the record. So that I think that was the whole piece. It seems to be an opportunity which has happened earlier with UPI when the whole payment system was getting digitized, and on top of it, now you see platforms like Phone Pay, Google Pay, WhatsApp. Everyone is building on top of the UPI rails, and we realized that there could be similar opportunity or even larger because there's more health. And there is a very very big economy, part of the economy. So why don't we take a leap of faith and kind of start building something around it, and the advantages when you're doing it for the second time, then you have patience in life. You don't really want to build everything in a couple of years and then think of, how do you move forward in life. So that's how when it started between us, and then we started thinking long-term perspective. How can we create more impact, and what can we like fundamentally change behavior? Right? When you again travel, there were like this 20 million consumers, started with 10, 15, 20 million, reached to 40 million consumers. That's where it all ended, and that's the impact in someone's life. But when you look at health could be, you can really touch everyone in this country. So the impact could be big. When you kind of save someone's life, and when you help someone get better, that feeling is very different. That the achievement, and then the whole uh, coming back from what you're doing is so great that you want to keep doing it better next time, and every day and every day and every day. I think that keeps us going. We're a small team. We started about a year and a half back in Bangalore, and building tools for doctors and then we started doing whole co-win kind of an interface for in partnership with the government of India. Large consumer base, super large consumer base, over 20 million consumers on our platform already, 5,000 doctors using it, etc., etc. But yeah, it's been exciting year and a half building from scratch. when COVID was very popular, we were sitting in doctor clinics, right? I spent most of my time during the COVID, sitting in the clinic, sitting with doctors, understanding what's their requirement, looking at consumer behavior, etc., etc. Was time from a personal point of view to start or something like that. But the great timing from as far as industry is concerned. Now we see people really care about their health and the vitals and etc. Want to store it. So that's been our journey. Sorry for a long intro, but yeah, that's what we've been doing.
No, I think I would ideally wanted to go on and on, but I think before I jump onto, Eka, and the thought behind it and what are you really looking at, I would just want you to possibly, summarize in 2-3 minutes the entire journey of Goibibo, Red Bus. I'm like, I still remember, and I'll tell you this thing. Okay, so 2017, I think March is when I reached out to you via email and said that, hey Deepak, I tried reaching out to your team, unable to solve my problem. Then you redirected me to Pratap, right? And the focus on solving problem, like a customer has got an issue, and that needs to be addressed, and that was pretty much evident from one-on-one email getting redirected and team solving it. And that talks about the kind of eye for detail that you have. So 2-3 minutes on in the Goibibo piece. I'm like, today you see Go MMT, everybody is just stick onto the platform. COVID is gone, but I think that's the only great choice available. So what about it?
No, that was the motive. We started in 2009 again, when and looked at opportunities, and there were players like MakeMyTrip, Yatra, Creative. Everyone was established. The flight market was literally established when we started up Goibibo, I remember. But the focus was how can we improve efficiencies and consumer experience. I still remember small things we solved during our journey was when consumer was looking for refund, it used to take 24 to 28 days, even on e-commerce, because there was nothing automated. And we said, why can't we start producing these refunds in 24 hours? And that was our agenda to start off. And what will it take? Because everything was manual, and we calculated risk of over refunding to the consumer versus the cost of call center support doing everything manually. And then we realized, right, even if we end up paying 5-10% extra to the consumer, there's a cost of processing a refund. That cost of processing a refund was more than 10% of the refund cost. So even if we end up paying like up to 10%, we're still making more money than we are spending on, and consumers would be happy. So that was like from our point of view, a simple consumer behavioral change on the flight side. And then a lot of things on the consumer journey. How can you book faster, right? The whole experience was that when you plan for a holiday, that planning is great. You really enjoy it. I'll see this place, I'll see that place, etc., etc. But when you book your flight ticket, when you book your hotel, that the time, especially the flight, was you really want to just get rid of it, right? There's the thing enjoying about it, right? When you're doing a planning, that's really enjoying it. You're thinking of, imagining, it'll be a hill, there'll be a beach, etc., etc. But when you're doing cricket, you want to do it right, because one mistake costs you thousands of rupees. And that cancellation fees is such a big beast that you don't want to do it. So you need to make a consumer experience so easy and so fast that you come in, do it, and move out. Very simple. No, so we followed these kind of journeys. During our journey, we built PayU, which you see today was our payment gateway. Turned out to be PayU, like a separate arm. Build it. Then in 2012, we started looking at Android as an application. People were building Blackberries at that time, and we thought, BlackBerry technology will probably not scale, so we might have just look at modern age technologies. We started building everything around Android, and that played out great for us in future. I think highest one of the best is in our lives to do this. There are a couple of more, like when we were building travel, then we realized that there is no way we can do offline travel. So anyone walk into our office with cash or a check and say, please book my ticket, we would refuse. We said, please go onto the site and book it. We have no other way of recording this transaction. Helped us a lot. We were really, really focused on what we were doing, and we could scale easily online. And then 2013 is when we started looking at hotels. I think that was the time when there was no one in India actually booking hotels online. Right? Total number of people booking room nights booked online was like less than 5,000 room nights a day.
Yeah.
What was the number across India? And then we started building, and we realized the problem, and fundamentally build a technology, a tool which is called Goibibo and called MMYT today. That's the largest used tool in hotels even today. About 70,000-80,000 of hotel logs into that tool every day to manage their inventory rate, pricing, etc. I think that was a big change in the industry, and then we taught everyone on the consumer side, did enough and more education on how to buy. So the whole experience of buying, what you see, what you get on the property. If you don't get, you get a refund. And if there is any consumer escalation, like a Domino's pizza delivery, will sort it on time. If we don't solve it, then we'll pay extra. From our point was, I like those are the focus areas we built it, and on top of it, the experience was so great that consumers started coming back to us. We still, I still get emails and tweets or LinkedIn messages saying I have some customer escalation. Please, can you help me get refunds, etc., etc. So I
That's
think
interesting.
that's how been the journey. But it's been really, really exciting building all that stuff.
Awesome. So, now switching gear into, healthcare, right? So the most ignored sector, I would say, in our country, and I'm sure we are not alone. There are a lot many other countries also, right? That even today, despite being so ignored, India is being looked up as, medical tourism hub from various African and sub-Saharan countries, right? COVID came, and I read a lot around, how Vikal got into the design mode, architecting mode, and today Arogya Setu, I think, is possibly the fastest made platform today at this scale, which is catering to, I think, every Indian, right? Wherein you are traveling, wherever you go, you need to have a co-win an Arogya Setu app, right? So what all has gone behind building that platform and the foundation of ECA, and what are you really trying to do with this?
So these guys have spent, I think, days and nights and just building it. It was like a mammoth task, and whoever were able to contribute would contribute, and it was like completely volunteered. So these guys have put in a lot of effort in building that, and then it was, there were many other agencies who started working on. But when they, kind of the whole team let it go off to NIC in August 2020. August, somewhere during the August, September, then we started thinking of, how do you build and what needs to be happening on the consumer side, on the doctor side in the healthcare space. And we figured out two opportunities. One opportunity we figured out was this whole shifting doctors. So the core fundamental behind ECA Care is that, like, you have a LinkedIn profile today. When I need to see a professional, then I go to LinkedIn and search for that guy and figure out, employment history, current employments, etc., etc. Similarly, we want to build something for healthcare. There's nothing today. So we want to build that Eka care profile for every Indian. So when a doctor needs to see Deepak Tuli and then, what are my family history, when I was born, any comorbid, any diabetic, hypertension, whatever it is there, last lab reports, last test, any hospitalization, everything. There's nothing. There's literally nothing in India. When you go to markets like US, Europe, you'll see that, from the birth to the death, there is everything. In India, there were two documents available, birth certificate and death certificate. There was nothing in between. It's completely hollow. And then whole NDHM team is building behind, kind of an ecosystem where this can be done. And then we said, makes a lot of sense, right? If we can get a lot of consumers doing this, there could be many, many research today globally. The numbers which we present in healthcare are not being recognized because we don't have baseline data to prove. If you look at amount of vaccination facilitated in India is so massive, but the side effects, counter, etc. No one talks about India, right? No one says, this is the percentage of success of COVID or COVID, or any other vaccination. And even our vaccinations took so much of time to get approved on WHO because the baseline data, the trust on baseline data is not there globally. Right? How do you make that? Because you need to have a technology, you need to have a trusted technology at the back saying, okay, this data, whatever is coming up, is the right data structures. And that's the opportunity we started latching onto. And we said, while we are building with NDHM team and solving, but it will take time, right? The things move. UPI, when UPI started versus when UPI got executed, there was a gap of 4-5 years. Similarly, NDHM, there are many, many things that are happening on that side. And we are working with, and many other players are working and trying to make that happen. And while you do all this, you obviously find business opportunities in between. But the large impact is on, how can you digitize these records? And that's been our whole agenda. In between, we found this opportunity when government opened up their COVID vaccination platform for private players. There were over 100 players who integrated with them, where private players were able to book slots or give vaccination certificate. We latched onto that and built very, very nice experience on top of those APIs. And thanks to that, we've been able to acquire about 20 to 23 million consumers. There are about 4 million app installs. We have over 600-700 monthly active consumers on our platform, doing multiple things. And then once we started getting this traffic, then we said, now what we need to give it to consumer. One is obviously you get your certificate. So we have till the time NDHM goes live, we partner with Gmail. And once you go ahead and sync your Gmail, all your historical reports, anything on Gmail will just come to us. We'll just scrub your Gmail like you do in financial sector today, and it's authorized by Gmail. Then we can bring in all the information. And I was shocked when I saw this. This is like magic, right? My report, which was 10 years back, I got a health checkup. It's now in my wallet. It's like surprising that how can that happen, and that's one of the things we started doing. So people started storing. Then we built a nice technology around self-assessment. So today, if there is something wrong with pain in my tummy, pain on my back, I'm not able to put my left foot forward, etc. I go to Google and start searching what is the problem, and that's been the big problem. And we don't know whether these are medically aware system or not. We build a medically aware systems where with people can put in their symptoms and we tell what could be the disease or diagnosis, and we redirect it to go to a doctor. So there is a BPM on our app. About 20-25,000 people do it every day. Put their finger onto the camera and we calculate the BPM and give the record. And then they put the historical record. And then whenever they go to a doctor, they share their historical record. I come every day, store it. See, the problem is this health devices, etc., are becoming popular, but there is still a large population who can't do it. So we've reached over 500 districts in India, facilitating them with all this stuff. So that's been our journey till now, and been really, really exciting. Numbers are large thanks to the whole COVID ecosystem, but we've been servicing consumers since forever now. Seems like 1.5 years, like a very, very long period.
Wow. I'm like, see, I don't see any challenge with regard to scale, because I think Vikal being the architect, done and dusted already platform for scale, right? The point that I'm trying to get to is the core underlying statement, right? Globally, social security is practiced very, very seriously. You go to the European market, you go to the US, you see that everybody is covered under social security. Hospitals, clinics, everybody is so serious about every document that comes. In fact, as a business, we work with some of the European hospitals, and we see a lot of data that is being managed there by the hospitals themselves, and then obviously tagging each and every data point with the social security number of that particular individual, so that the individual can access the entire history. Even the doctors can access when an individual go to a doctor, right? To the same perception or the same thought being followed in India. Don't you think that there's a huge friction even within the system right now? Bringing that data in, a lot of I think questions being raised on data security. Why this much data? Why is it required? What would happen? All of it, right? So comparing to global vis-a-vis Indian market, what do you think is the biggest friction right now in building this entire digital journey? We'll come to NDHM also next.
So I think, so I had a similar perception some time back, but while talking to all these big players in the industry, I think the biggest challenge in the industry is technology and ease of doing it. So today, for anyone, either a healthcare provider or a consumer, there's no easy way of doing it. Right? The things I'm telling you, when consumers start doing it, but still it's cumbersome for consumer to do it, right? I'll give you a Gmail sync, you can forward it on a WhatsApp number, you can forward on a Gmail account, it all gets synced. But the originating facility, which is in a hospital or a doctor or a clinic, they need, if they start doing it, because what happened in the Western countries where you said their payment structure, the incentive is structured in such a way, they only get paid once they produce the right documents. In India, it doesn't happen, right? Except at the government hospital, and that too, they're very, very far behind. So, and unfortunate problem there is when you become a doctor in the whole college, you've been studying with pen and paper, forever and been writing, and then you're used to it. And there are no easy ways of doing it. It's hard. So every technology which comes into the market today doesn't help reduce time of a doctor. See, we have a massive load on doctors. The ratio of doctor to the consumer is really, really bad, and the payout for the doctors are also bad. Right? When a US doctor would see 5 or 10 or 15 patients, our doctors will see 40, 50 patients. The payout for a US doctor would be 25, 30, $40 at minimum. In India, it will be $500, less than $10. So there are fundamental difference there. And then when you add technology, doctors take more time in typing rather than writing in the hand. So when you have to see like 100 patients, what will you do? When you have to do notes of, so people need to create technologies which are easy for doctor to type, right? They don't have to type too much of information. How can you save time of a doctor? If you can save time of a doctor with an easy technology, it's a SaaS, right? Doctor just spend 8 hours, 10 hours in front of that computer, typing it out while looking at patients and taking decisions. So I think that's a big challenge out there. And then another biggest challenge in the industry is the technologies whichever has been built in India. I have not used any standard at the back. So when someone says, a symptom, hospital A would say a symptom in a different manner, and hospital B will say in a different manner. In US and UK, there are standard technologies like line codes for the lab reports, or symptomates for symptoms, etc., etc. India, we don't follow. Majority of the hospitals, majority of the labs doesn't follow. So with that, even if you get data, it's very, very hard to kind of put them together and see in a longitudinal manner. That's been one of the challenge, and we solved with NDHM again. Solving out for the lab report. So today, when you go to a lab A and then you go to lab B, the way they calculate the findings, the results could be very, very different. So someone can say your hemoglobin at 11, one lab can say you're out of the range, and another lab can say you're within the range. It because the way the kind of the process they follow, the machines they follow, results could be varied. Now, how do you and no one goes to the same lab again and again, right? You think of yourself, how many labs have you switched on in last few years? So standardizing those and figuring out that hemoglobin is hemoglobin somebody can misspell it, somebody can use the code, somebody can do anything in the report. It's been a challenge, and we've been able to solve that to 95% cases. The people, when they upload a report on a platform, we standardize, build the structure, and give longitudinal data. So my hemoglobin was high in 2009-10 and went down, and then now it's back high. So how can you give that information back to the consumer is being also a challenge through technology. I think there are many companies trying to solve it. Hopefully, with all the focus on health, things will get solved.
Amazing. I'm like, this is very interesting. Talking about NDHM, right? So for anything to really work well in Indian context, you obviously need to have regulatory body on your side, right? Because you're talking about people, data, patients, symptoms, and obviously medicine has been one of the most critical areas, right? Wherein nobody really wants to, get the cat out of the bag till the time there is enough information, right, credible information available. So what do you think of NDHM, the push that the government is, having behind all of this, right? In terms of making people aware about how they should be kind of, looking at the data historically. How do you make them, tech savvy? Because I'm like 30-40%, you would have also seen in your previous stint, getting people used to digital is easy in, bigger towns, but the larger chunk of India lives in what people say Bharat, which is more of, semi-urban or rural touch, right? So how do you get to that stage while NDHM is doing a lot of things, right? So what's your experience on working with them, the push that is there, and 3, how do you make sure that it is really scalable to the T? Yeah.
I think in that regard, this DHM team, we deal with them very closely. And I think they're doing a great job. Even if you look at COVID, as I said, I have seen people using our platform for downloading the certificate in the smallest time you can think of, the smallest ever time. So adoption to technology, if it's easily done, is possible. The phone is there, the device is there, internet is there. It needs to be simple. So when people download certificate on our platform, they just use WhatsApp as a technology. They just send their a phone number and then they have to just put an OTP and the certificate gets downloaded. It is as simple as that. That's what people come to. So those kind of things we need to do to make it happen in the smaller town. But the adoption, as you must have seen in any other product, the alpha starts from the metros, and then the followers will follow. The alpha need to move first. And for alpha to move first, there are enough and more incentives because alpha want to have the records because there is a value. The value you might derive only once in a life or twice in a life, but that is saving the life, literally. The kind of tests people do, the trauma centers, when there's an anti-allergy and the drugs been given, people they can just simply die off. So people who think of those values really cares about it. Now there comes the second biggest challenge in this category, which is how do you get this information from the origin, which is hospital, which is the doctor clinic, which is lab, into the system. Once that comes to the consumer wants it. See, the unfortunate problem in Indian healthcare is consumer wants it, but they don't have choice. All of us want better healthcare. We are ready to pay for it. All of us want our records to be in a place, but all of us have no other choice but go to the best doctor who doesn't want to digitize. Maybe you don't have a choice. Go to a hospital which is best in the country. But if you ask for digital record, they ask you extra money. I have seen this in Burma. I said, go to the top hospital, you pay 200,000 rupees for your treatment, and then say, hey, okay, do you need digital record? You need to pay 2,000 rupees extra. These are my records. So I think that's where the government bodies are working. They're working very closely with all the top hospitals, top clinics, top doctors to give that. Once that starts happening, then think from a consumer point of view. As a consumer, I just don't have to do anything. I have to give my health ID at every place. That's it. Like when I go and pay through Google Pay, Phone Pay, Paytm, I just simply scan. Similarly, I have to give a QR code which the healthcare delivery partner can scan, or you can just go give your ID and they can add it, right? And these IDs are associated now with a phone number and an Aadhaar card. So this is unique to everyone. And then it's got all getting on the NDHM rails. We'll go to a PHR app, which is like us. Like no government can't store your record, or government can't store my record, but private players or the PHR apps, which is, Aadhaar, which would be Aragya Setu, which would be Eka Care, they will store your records, which are coming through these rails, and then use whenever consumer wants, they will use. So I think these are the things they're doing, and doing very, very smartly. And this team has done the same under Dr. Rajesh Sharma, who has built COVID, and it's been used in every corner of the country, and UPI. I think all those experience will come handy here. I don't think there's a problem in adoption on the consumer side. The problem will be on the healthcare delivery partner side.
Okay, got it. Interesting. So when we talk about the service provider or care provider side, right? What are the changes that you are seeing, or what do you think are the changes that are most important at this point of time, and how that problem can be solved, right? Because that consumers are ready to adopt because it's their data, right? But at the same time, there's a lot which has to be done by provider, whether it is a doctor, it is a clinic, it's a hospital, or it's a path lab, right? Obviously, there are players in market that are doing it digitally. We know them all, right? So what do you think are the key challenges and the way to solve it more from the provider side?
So the first of the changes, I think I've seen many changes, and fundamentally completely changed my perspective also. So from the doctor point of view, there used to be a concept called my family doctor, right? For everything, I go to that particular doctor, and it'll be one doctor. I think that mindset on the consumer and doctor side is gone. People now understand, thanks to Google, people just now understand for which kind of specialty doctor I should go to. So that perspective of doctor has gone out, and for the consumer is also gone, which is great for the industry also, that people don't, especially the good quality doctor. If you go to a good quality doctor, and the doctor is not the problem is not under his preview, he'll just redirect you to somewhere else. Now consumers are getting redirected, so there are no problem for the patient to wait, etc., is happening, and that we fundamentally accepted. Doctors also accepted that the record belongs to the consumer, so it's better to go digitize. So doctors, especially the alpha doctors, are moving to a digital prescription, because they also want to have a record of their patient. You're coming to me for, again, if I'm a diabetologist and the patient is coming to me for last 5 years, I don't want to keep looking at the file. If there are 100 lab reports, I don't want to look at reports. I want to just look at one standard structure format. Data. So those things, they have also started adopting appointments, sending message before the appointment, taking appointment, coming, just not walking into the clinic, etc. So things are changing at the doctor and the clinic level. And on the hospitals, when we started doing hospitals early in our research, I used to hear from the owners or the heads saying, our data is worth millions of dollars, we don't want to share it. And when you ask them, how much money have you made in last 1 year, 2 years, 3 years, they would have said zero. Because everybody would say, the data is valuable, but unstructured data is of worth no value. You can't make money out of it, right? Yeah. So that change has come. So now everyone wants to put structured data. Everyone realized that, it's always better to give data to the consumer and have a very healthy relationship. Good quality service. Play on services. Don't ransom, don't put a gun on consumer head and then ask them to come back to you, right? Because my data is with you, I'll come back to you. So those things are fundamentally changing completely into the ecosystem. There are still hesitations in the old or some senior doctors, depending on the age category, which is fair, because they're not used to it. But I would say any doctors who've been practicing for 5 to 15 years are looking at these kind of things are changing rapidly. And this change will be super fast. I think if the healthcare can't change now, it will never happen. The COVID and the whole situation around, and the whole focus on the health is so much across the country, and the consumer and doctors. If they can't change now, this will never happen. This is the only time it can happen. Otherwise, things like COVID will never happen again hopefully in our lifetime. Nobody wants to have that. And the whole mindset will not be there towards, digitizing. Doctors have seen sitting empty clinics and doing teleconsultations, for an example. Right? So people are now open to technologies. People are now open to new technologies, moving to that direction. I think so. Those are the changes that are happening, and on the positive sides.
I think this is very, very interesting, because I do remember, in the West, there's an app, I think one of our fellow, technocrat from India went to the US and built Suki, right? So the whole idea was to digitize the entire patient-doctor interaction to make sure that it is largely automated, and kind of, the data is put in a structured format, because largely, I think there is a huge data, right, which is available. The more manually you do it, the more problems will you have in managing it, right? So from a system or a platform perspective, at Eka, where do you see this entire platform going from today, where it is, wherein you are, gathering all the health related data, to where it would be, say, 2, 3, 5 years down the line? What problems would it be solving for people?
So one problem we really want to solve, and not looking at multiple problem, is basically this whole historical structured data for every consumer of ours. I think that even if we are able to achieve that one thing, it'll solve a lot of problems. And and it's easier said than done, because even if whatever put on everything in our system is structured, but we get so much unstructured data, we're still figuring out every day how to put them into structures. Because unstructured data is useless. If you go to any Western world, the data, structured data will be 95, 100%. In India, even if we use exactly the same standards, but it's very hard to get that structured data. So even if we are able to put structured data for our own consumers, and we'd be able to make a longitudinal graph for everyone. So, if I can share Deepak Tuli's full information to a doctor on a single click, in a manner, the way you and I see our graphs of growth of traffic, etc., it will save a lot of time for doctor, and they'll be able to take better decisions. So the important thing is that these two, right? The time of a doctor, till the time we get more doctors in the country compared to the population, and quality of service, right? The important is that how can this help doctors to prescribe better drugs, prescribe a better tests, etc. So because the pressure is so much, in so many cases, doctors, generally don't ask too much of detail about the problem. So what will happen when those things are, they're not able to prescribe better drugs. So I think that's the one thing really want to solve. The whole information should be so easy for doctor to read, so that they can ask anything related to now and take better decisions.
Cool. I think this itself is a huge problem statement. Right? Today, I'm like, you go to a lab, get the documents, slip it somewhere under your bed, right? And come Diwali and everything get washed out, right? So you obviously do not really maintain it. And with technology, obviously things are now falling into place, wherein, reports are coming on WhatsApp, coming on email. And obviously, at least if not for the entire historical data, at least last 3, 4, 5 years, if you can get, that can obviously enable doctors to take the right decision. I think this is really good. This actually kind of helps me connect with something that even we are solving. I'm like, we are working with some of the hospitals and healthcare companies, wherein it is largely again on diagnosis front, right? So one of the verticals that we have is data annotation, which is largely to do machine learning operations, right? So wherein say you've got say X-ray reports, or you've got some health records, right? How do you know that it's a right diagnosis, or are you able to diagnose some of the basic things through the machine learning model itself, wherein you don't really need a radiologist to kind of find out that, oh, there is waterlogged at the bottom level of the right lung or left lung, something which can be automated, right? And then you're only using doctors for validating what the machine is identifying. I think that data also right now is not in digital form available with anyone, right? It is only available in hard copies, and once you have it in digital form, the output metadata showing what kind of health diagnosis can be there, this can holistically give a very critical I think solution to practitioners, right? Wherein they don't have to really wait for the data and diagnosis to come through the entire manual chain and cycle. So I think this is really very interesting. What about the entire data security piece in this entire chain, right? I'm like, every now and then people talk about, say, because if you're talking about health, it is not just about some disease, it is also about sexual wellness or something else. But people are very very, very specific and finicky about, I would not want to talk about these things. And if somebody like Eka uses it and then there is a data breach, I'm panicking, right? So how does this entire data security in this entire open world you think is going to work? Or is it like I come on to Eka Care, there's a data which is shared with Eka Care, and then I go to somewhere else, then there is data shared again there. So what are your views, thoughts, or belief with regard to data now?
No, I think that's one of the biggest challenge in the industry, and then there are challenges on technology side and then just making decision making. So there are two aspects of data in the entire system. One is personal data, name, age, gender, phone number, Aadhaar card ID, for an example, and then there is this medical data, which is symptom diagnosis, drugs, medical courses, etc., etc. So we don't do anything with the name, phone number, of that individual. So it's all anonymized. The medical data, like for example, my data would be read as like a male based out of Gurgaon, 40 years old. So that data and this kind of symptom they use, because without that, you can't give meaningful value back to the consumer. You have to, otherwise there is a Gmail storage, there is a Dropbox, there are many other places to store this data. It's very, very simple value proposition that we only read medical data anonymized, so we don't know who that consumer is. It gets associated with the consumer. That's one side of data, storage and representation. Sharing is absolutely on consumer consent. There is no way that I can see anyone's data or somebody can seize my data, even at the doctor's level. We keep getting information that give me this data, erase that data, erase that data. There's no way I can't erase or anyone can erase the data because there's a trail around it. And then if you need to share data, there's a consent process that you have to say yes or no, share with whom, for what time duration. So even if you're going to a practitioner and you want to share the data only for an hour, it will be shared for an hour. After that, that link will go. So those kind of things are taken care of, so that you probably have to go to a practitioner once and say, I want to show my records for this consultation. After that, I don't want to show it. It's my choice. It's my data. So it's all in the consumer's hand. Consumer choose not to share data. We don't have any access. No one gets that access, except the machine gets the access of medical data, not the personal data of the consumer. And we're very, very particular about it. There's no way without the consumer can delete their data, but no doctor or no healthcare repository can delete consumers' data. So the owner of the data is the consumer. They take the choice, and we store it practically the way we store that information. And luckily, we've been working in this space for years, understand the security really well, and work closely with the best technologies around data. So yeah. All my personal data is there, so hopefully it's safe.
Oh, okay. This is really interesting. I'm like, it looks like we can go on and on, but I think in the interest of time, we just have maybe about 10 minutes and we would wind that up, right? So taking this to the next level, so we've been talking data, we've been talking about hospitals, right? One of the key things which has been, which India largely has been lacking on is the insurance side, whether it is health or life or general. I'm like, people feel that, now even PhonePe had to come with an ad saying that you can get an insurance at per day basis, right? So what do you think is the state? Because, obviously when people do not care, they do not go for an insurance. So what's going to happen with the entire insurance space when it comes to health, and how this entire ecosystem is going to, come together? Is there anything which you are really working on, or really you think that there is a problem yet to be solved in that space?
Yeah, I think especially the health insurance, and I'm close to it. Rest, I would not like to comment. I don't have too much of information, but health specifically, if you look at today, health data is only about health insurance, is only about corporate insurance. People get it from corporate. Individuals are very, very small. 70-80% of the market is through corporate. Only 20% of the market, and there are many reasons around it. Our insurance is only when you get hospitalized, versus so the probability of getting a claim is very low. And the other important aspect is no one wants to use that, right? But still feels the pain. So So if you feel the pain that you've been paying, say, I pay about 20,000 rupees for my family every year. I don't end up using, I've been doing this for 10 years. Claim what 20 lakh I've already paid in equivalent amount or more, especially when you're young. So you say, why am I doing it, right? Literally, why should I be doing this whole thing? So that's how, that's where it is on the consumer side. And when you have to pay, which is your lab test, which is your health checkup, which is your OPD, which is your medicine, which is definitely going to happen, and you're paying from pocket. So that cost is anyways coming on to you. So there's a full change happening on that side. And especially after this COVID, people are really, really, really worried about their health. So people are worried about their health, and they've looked at spend. So they want to take insurance. Insurance is going to increase for sure, and it's been increasing even in the tier 2, tier 3. Government is putting a lot of pressure on to hold this ecosystem where they want to kind of insure up to 5 lakh rupees for every Indian with below a poverty line or below a income group. So I think there is this whole focus on, but how the companies can drive value to a consumer every week, every month. That's why this recurring every month that you keep seeing the value. So it's a today there's this threat in my mind. I take the insurance, I don't see the value. The insurance company needs to come with a plan where they see consumer sees the value and get this kind of revalidated every time, every month, literally. So that needs to come, and there'll be changes happening around it. I've heard I was reading some of the articles and talking to some people around. There are a lot of changes happening around this. New IRDA chief has come in and he's trying to kind of push things around this direction. This will change the fundamental games, number of people taking insurance.
Wow, interesting. So while we move towards the last part of the chat, there are a few audience questions as well. So Shimachalam has asked that in US there is PHI and HIPAA guidelines to protect consumer data, right? What about India? Do we have something like this coming up in India as well?
There is obviously there is nothing in India as on today, but there are guidelines around data security, and there are new regulations coming around data security. Should be very, very soon, and health will be a super sensitive category in that, similar to HIPAA, in that whole data security of Indian Act, which will be the way that the data needs to be stored is, you can't take consumer phone number, email ID and map it with the health conditions. It'll be even sensitive than the financial data, because, as you said, it could be any kind of disease and people can, really take advantage of it. So there are things which are coming up. There are companies who started following this already, because you don't want to get into the wrong side of it. People like us, irrespective of you can't solve 5 use cases, which is fine, but you don't want to get onto the wrong side. But that is coming clearly, and government is very, very cautious about it. So it will be sooner, hopefully in next 6 to 12 months, it should be like in the practical scenario available for everyone.
Cool. Okay. The next question is, where do you see the healthcare tech in next 5 years? What changes would come in health tech companies, doctors, patients perspectives?
So I think this connected health ecosystem should be changing, where today the whole power is on one side, and everyone like on the other side is just the receiver of it. It's changing. It's a change in many, many places, changing further. So there will be more open, transparent conversation between the healthcare provider and the consumer on platform like ours. There'll be obviously everything around technology will move. People will have their records available. Doctors will have ease of doing teleconsultation will become like a real reality. People are using it frequently, saves a lot of time, saves everyone's energy, etc., etc. Hospitals, clinics get connected, and things like those will happen. I also believe that this whole change in the financial side of it, which is insurance, will also completely change the paradigm, where the payers will be paid on behalf of the quality of healthcare being delivered rather than quantity of healthcare being delivered. Today, everything is incentivized based on the quantity, not on the quality. So tomorrow, that will happen in another 5 years, where it will be more quality driven than the quantity driven. Especially the primary care will completely move into this direction.
Awesome. I think this is really very, very interesting, and I'm like, healthcare being one of the areas that is also very close to me personally, and obviously at FiveS we try and see what all can be done in this space while we provide, obviously, services to our customers. I think there is also one key area, which is, acquisition. And then obviously everything runs around economics, right? So when anybody is looking at health, how do you say that, I want to make money out of, you falling sick? But at the same time, that you exist because you want to make money out of it. So what do you think, or how do you think that, you would be kind of, looking at getting that done, being in this space? And I'm sure that, and I'm hoping that I will not be talking next time to Dr. Deepak Tuli, right? So yeah.
No, so obviously you don't want anyone to fall sick, but unfortunately that's not the reality. People will fall sick. So there are two ways of making money in the whole ecosystem. One is obviously kind of become an intermediary, which we were earlier, and then take from one hand and give it to another and take your commission out of it, or you become an administrator and charge an administration fees. We choose the next route, because when you become a seller or a reseller of services, then you tend to kind of follow different path and different ways of communicating and selling to consumer, versus when you become an administrator. So at the end of the day, there is going to be spends happening. Everyone is going to spend. We want to be the facilitator of those spends, and take our administrative fees, which is very small, and either the service provider or the consumer will pay for those. Like for example, storing the health records, consumer will pay fees, right? Because it really helps them. And then accessing those records, the healthcare provider can pay small monies, right? There's like a facilitator, small monies, because the large population is using you, and there is a large amount of transaction happening in the product. The small will help you, kind of let your organization. And at the end of the day, we are a private company. We need to, kind of run it. And it's not a charity. So all those things will happen, but it will all happen in the way where you don't interfere in the outcome. In fact, you interfere in a way that the outcome is better. So if you can save someone's life and make 10,000 rupees, I think it's worth it.
Right. Cool. I think this is really nice. So what are your plans? Because obviously, when you already mentioned that you're not here for charity, you're going to make a business sense out of it, and you have chosen to be an administrator rather than possibly being into a commission game, right? Scale, I don't see a problem, because you already have a massive scale, right? And because it is driven by need and not really by wish. So I think scale is available, and obviously I'm like, you're not going to stop at $4.5 million funding. You're going to go beyond that, right? So or you've already gone beyond, right? So I think from a business perspective, what would be your top 3 priorities over next 18 to 24 months in terms of business, right? So while obviously the outcome is care, but from a business standpoint, what are your top 3 priorities that you are going to focus on, obviously delivering value to the consumers?
So actually, rather, I would say even narrow down, we have 2 things really falling up. One is number of doctors on our platform using our technology for their clinic management. Today, we have that number at 5,000. We want to take that to 50,000 in next 12 months. So that's our objective on the doctor side, and we're acquiring literally at a very rapid pace. And the clinic man, so that impact, so that indirectly gets impact to the consumer, because all the consumers walking into these clinics get digital access. So that's the one side of it. Second side of it is we want to have consumers longitudinal data on our platform. So today I have over 1 million consumers where I know their medical conditions, diabetes, thyroid, cancer, skin disease, any. So I can categorize our 1 million consumer and what kind of problem they have. So this data we wanted to make even more reliable, where we take their heartbeat every day, we take multiple self-assessment in a year and figure out the medical condition of that guy. Now, what will happen with this is, and there could be many ways of monetizing, right? Today, we can go with this data to healthcare providers and give them insights on different geographies, so that they can take meaningful business decisions out of it. Like for an insurance company, what kind of insurance product do they need to launch in different categories can be driven out of it, provided we give them the right anonymized data. Like pharma company, for an example, today there is a drug used in Kerala and the same drug is used in Punjab. The side effect of the drug could be very, very different because of the sheer, kind of eating habits, sheer population difference. And there is no way for these pharma companies to get this data. With our consumers, we can get to, see, two drugs combining together, what kind of side effects, etc. At a large scale, environmentally again, on the different consumer side. So these kind of information can help them produce better drugs, can help them produce better clinics, put more hospitals, etc., etc. So there could be many, many ways of making money rather than just simply charging from consumers and the healthcare providers. So there will be many venues once you have the right scale and amount of right data. Like tomorrow, you can go back to a comment and say, hey, this region, I know this kind of disease is spreading, so why don't you take corrective actions and stop the spread? How can that happen once you start seeing the trends on our platform? So on a hyperlocation levels. So those are the things which will help us, kind of build right businesses. And we definitely don't want to stop. This is a massive industry. We want to be soon a unicorn. So there's no end to on the business side of ambitions on the business side. There's no end to it.
No, absolutely. I think that's pretty much achievable as well, because the problem that you're solving is a very real and a massive problem, right? And I don't think that even without knowing EkaCare, just by your name, I would have possibly figured out that customer acquisition would never be a problem, scale would never be a problem, right? And consumers will never be a problem, right? And I'm sure that I would not even want to ask this question, what's your customer or consumer acquisition cost, right? Because that's like, that's driven by need. So I think people come and pay you for that. But I think there's a lot more to be done in this space. Do you really see any competition or threat?
This space is massive. As I said, right? Everyone is your consumer. Everyone you see is your consumer, literally. So there's no competition, no threat. Yeah? It's just a beginning of health tech in the country. So in fact, everyone is like supporting each other. There are many players will help move the ecosystem better in a technology manner. And we're a firm believer. If you are doing right things and with the right intent and right technology and right processes, when the things will move online, you're going to gain, right? That's what has happened. And the people who will follow the shortcuts will not gain. So it's better to have more competition so that your cost of moving industry online is reduced.
Oh yeah, absolutely. And then that itself is a validation of the fact that you're doing the right thing, right?
Yeah.
No, I think this is really great, amazing conversation. I didn't realize that it's almost 1 hour, right? So yeah, I think very insightful conversation. People have been silent by virtue of the way we keep this, but obviously there are a lot of questions that have come in. But I made sure that I cover my list first and then kind of look at a couple of others. Deepak, thank you so very much for such great insights. Guys, if you want to go and create a ABBA ID for yourself, go to EkaCare app and you can get it done very quickly. So, and go and check out. I checked the app and I said that, okay, Gmail, I might possibly have some friction kind of putting that across. I might think about a few things, but if it gives me the benefits that are much larger than the data that I share with you, I think I would certainly go ahead and do that, because at the end of the day, I know very well that there's no other way for me to store my data or kind of consolidate the entire data into one single platform. I think this has been really very insightful, and thank you so very much for coming on this coffee chat. People possibly would take a lot of learning in what's happening in health tech space, what's going to happen over the next 2, 3, 5 years time. And I look forward to catching up with you sometime in Bangalore when time permits at your end. I'm sure that you're a busy man, but would certainly try and catch up with you.
Definitely. I'm looking forward to. Thank you very much.
Thank you so much, everyone. That's it for today's coffee chat. See you next month. Bye.
Bye.
Thanks. Bye.